begin the whitening process today, we want to really make sure that we're going to grab some photos first. So this way the patient will understand exactly where they're starting, and putting in a good shade tab is going to help us to track how much whitening Pam's going to achieve. And that's really important as we go through taking really good pictures. We want to make sure that we capture exactly where she is with our Vita guide, and then that way we can really see exactly how much whitening was done and how great of a difference it's going to be within those next couple of weeks. So I want to just grab my Vita guide today, and let's just look together just to really see exactly where Pam is. So Pam, I'm going to have you hold this with me, and let's really look together just to really assess where you are before we get started, okay? So smile really big, and let's just kind of see. We definitely know that you are lighter than that, okay? And I will tell you that I think you're probably even a little bit lighter than the A2. What I'm noticing here is that I know that Dr. Corman has done some bonding on these front teeth, and they look absolutely beautiful. Our objective really is to get the rest of the teeth just a little bit lighter to match. So if we look at that and we hold up the shade tab, I think that you're really close to an A1 on these front teeth here, but I know as they go back they're going to look a little bit darker, so we want to brighten those. And then on the lower it looks like you're pretty much closer to an A2, which is great. A's are the easiest to whiten, and so we won't have to work quite as hard to really achieve a really good blend, I think, with these, okay? So the first thing I'm going to do is have you lick your lips really good for me, okay? And we're going to place these in. And now these are clear retractors, so what it's going to do is kind of help us to really make sure that we can lift those lips out of the way. And you're going to be my helper. Perfect. Got it? And I'm going to have you take this hand and come on the back side. So on the top here, I'm going to take a quick picture of just exactly how we feel these teeth on the front look, okay? For me, Pam. There you go. Now I want you to close, say just like that.